As a surgeon, what is the scariest thing you've seen in the operating room? A 30-year-old man came to see me for unexplained visual loss in one eye. I thought there was a mass pushing against his left optic nerve and ordered an MRI. This demonstrated that the mass was in fact a large aneurysm of his carotid artery against the brain. The protocol was to send such cases to the vascular neurosurgeon who saw him the same day. He agreed on the diagnosis and ordered an angiogram to better show the aneurysm. Both the angiogram and surgery were set for the next morning. This was about 1987 and there was no way of fixing the aneurysm without open neurosurgery. We were lucky as Dr. T was world famous for his technical ability, and he was kind to allow me to come as his assistant. The skull was opened by the resident by drilling 4 holes that were then connected with an electric saw that had a ridge to protect the soft brain beneath. The large skull flap was removed and the underlying dura, tough skin around the brain, cut and flapped back, exposing the brain. For the next hour the chief resident pushed and manipulated the brain to one side, and then a ridge of bone had to be drilled down for better exposure. Then we had a clear view, the juncture of the carotid and ophthalmic arteries with a big bulging arterial aneurysm coming straight up at us. Before touching this, Dr. T placed 2 cords around the carotids on both sides, just in case, he explained. Then, a silver aneurysm clip was slipped in behind the aneurysm and slowly released, allowing the 2 prongs to cinch closed over the neck of the aneurysm. Only I didn't get to see the last part. Suddenly the entire brain pan filled with blood. I was suctioning but couldn't keep up with the outpouring of blood. The resident ripped his suction tip off and I followed suit. So we went with these hoses into the bloody opening. But we couldn't make any headway or even see the brain. Dr. T couldn't see a thing and blood was spilling up and over the edges of the skull. A nurse started to read the falling blood pressures. 110/65, 90/50, 70/40, 55/0. Then the anesthesiologist said, "We've lost him." Blood pressure crashed to unmeasurable. The nurse was squeezing bags of blood into him but couldn't keep up with what was pouring out. Now if this happens in the abdomen, you compress the bleeder or place clamps. But in the brain, you don't have those options. But cool as a cucumber, Dr. T stuck his hands below the surface of the blood and began feeling about. He tied off the carotids proximal to the bleed. Then suddenly our suction worked, and the blood pressure came up from 0. Dr. T examined the area and laughed. There was a second aneurysm hiding behind the first one, he exclaimed. A second silver clip was placed. Then the carotid ligatures were removed. I turned to the anesthesiologist and said, "Were you scared?" "No," he said, "just sad. He was dead and I saw no hope that we could get him back. Such a young man." 2 hours later I related the story to the patient's wife. On follow-up, the patient did great. He even got his vision back. I have never seen such cold-blooded rapid action under fire. Dr. T didn't even take a second to swear. Afterwards in the doctor's lounge, he smiled and said, "It's more fun when it goes like that."